Yes, thank you for having me today. And I'm happy to share the background of our study. So, several quantitative and visual PSMA PET CT imaging indicators have been proposed to predict response to lutetium PSMA therapy, but it's still unclear which ones are reliable in real-world clinical practice. So, current SNMMI and ENM guidelines clearly emphasize the importance of pre-therapeutic PSMA PET CT, but they do not yet specify which imaging indicators should be prioritized for patient selection. So this gap motivated us to analyze data from US Expanded Access Program, or EAP, which provide lutetium PSMA therapy to patients with metastatic castration-resistant prostate cancer before FDA approval. The EAP used inclusion criteria similar to the Vision trial, but with more flexibility and reflecting broader real-world use, and including patients previously treated with novel hormonal agent and chemotherapy. And this gave us the opportunity to test this imaging indicator in practical setting. That's a great question. As I mentioned earlier, many PSMA-based imaging metrics have been proposed recently. However, to truly integrate this into clinical practice, we need to ask whether they offer added prognostic value beyond well-established clinical biomarker like PSA. So in current treatment planning for lutetium PSMA, once patient is PSMA positive, decisions are often made based on basic clinical factors such as PSA level, hemoglobin, and other lab values. These remain very practical and widely accepted. And our study adds to the composition by showing that certain PET metrics like whole body SUVmean may provide additional prognostic value and help anticipate which patients will truly benefit. In some cases, imaging biomarkers might even help us reconsider treatment strategy, like using stronger treatment or choosing a different option if we know in advance that a patient is unlikely to respond well. Yes, that's correct. In the our EAP cohort, we evaluated how various PSMA PET indicators link to treatment outcome, such as biochemical response, PSA progression-free survival, and overall survival. And overall, we found that quantitative PET metrics were more strongly associated with outcome than visual assessment tools, and the total region quantity, or TRQ, for example, showed a strong association with overall survival on its own. However, when combined with clinical factors, higher SUVmean emerged as the most robust indicator of longer overall survival. So this suggests that SUVmean may be the most stable and clinical practical PET-based metrics for informing treatment decisions, especially when interpreted alongside standard clinical data. Yes, I completely agree. That's an important point. Also, since the calculation of these quantitative metrics can differ by methods or software, we need at least some degree of standardization to make broader implementation feasible. So realistically, visual assessment remains as a practical and useful method in routine clinical settings, especially until this quantitative approach are widely implemented. However, because visual assessment is naturally subjective, so visual reads should ideally be done carefully and preferably with consensus among multiple readers. At the same time, I believe it's important for researchers to continue highlighting the value of quantitative assessment. And by doing so, we can help more people understand that PSMA PET metrics are useful for predicting treatment response. And this will gradually support the use of quantitative metrics in everyday clinical practice. when we see a patient with high SUVmean and especially low tumor volume on PSMA PET, even if their PSA hasn't changed much, we need to recognize that this might be an ideal window for lutetium PSMA therapy, and we shouldn't miss that opportunity. On the other hand, if patient has low SUVmean and high tumor volume, even though they technically meet the eligibility criteria of lutetium PSMA therapy, the response to lutetium PSMA monotherapy may be limited. So we don't know yet the best approach in this situation, but it raises the possibility that we may need to consider combination strategy or entirely different treatment option in those patients. And of course, SUVmean-based patient selection hasn't really been tested in prospective clinical trial yet. And we still don't have a clear cutoff for this continuous variable. So ideally, a prospective trial that assign treatment option based on SUVmean difference would be needed to confirm whether this selection approach can actually lead to better outcomes. And that kind of evidence would really help establish PSMA PET as a reliable predictive biomarker in the future.